So, next thing that we're going to talk about is scar tissue. So, eventually, if you've had surgery, you're going to have some scar tissue. It might be visible, so it might be somewhere on the outside. It might be not visible. However, it still exists wherever everything was kind of cut, sliced, whatever. Pretty unlikely that you're going to get away without any scar tissue, unless very very tiny incisions were made. I know things are kind of getting better and better in terms of what's possible with surgery, but I think it's safe to say most people who are watching this, if you've had a surgery, whether it's recently, a long time ago, you've got some scar tissue associated with that. Here's where I think the kind of aftercare for surgery misses out on quite a lot of things that, while not essential for you to be able to get back to like a normal level of function, can really get in the way of like getting back to your best self. And that's the idea that scar tissue is potentially a really sensitive area of the body. Scar tissue reflects the brain's experience of like a really negative event. The fact that it's creating scar tissue means it's probably put a load of protective measures in place to kind of prevent that happening again. And with surgery, that can be even worse because the scar tissue, as far as your brain's concerned, just kind of appeared there. Everything got switched off, slowed down. Then when you came back to, suddenly there's this like incision that's been made that is causing like major problems, and the brain doesn't necessarily like that. What I tend to find with people is rehabbing scar tissue can actually have a really positive effect on returning to normal function after surgery, but very few people ever look at it. And I guess like the research is probably not amazing on this at this point, but a nice little way to check it is if you get something like this is just a pulse oximeter, so it's going to read my heart rate. If you got a smartwatch, you could maybe do the same thing. Apparently it needs batteries, but if you were to get a reading of your heart rate and then you were to, is this working there? I think it needs a battery replacement, but let's pretend it was working. And let's say that, oh, there we go. So my heart rate is 81. Okay. So my scar tissue is kind of over here. And if I were to touch the area where I had the surgery and just kind of hold it for a little while, if the scar tissue is still hypersensitive, what you'll probably find is I get a little bit of a stress response. So in this case, not a whole lot seems to be going on. Okay, and that makes sense. I've done quite a lot of work around the scar tissue. But if you saw that either your heart rate starts to spike massively, or in other instances, it can really drop, then that's a pretty good sign that your brain is still kind of dealing with a little amount of trauma from the scar tissue itself. And if you were to look at rehabbing this, that could be pretty useful. So in terms of the rehab, what does that look like? Generally, some kind of like touch, massage, hot, cold, vibration, any kind of like touch stimulation can be potentially pretty good. Sometimes it can be really forceful. Sometimes it can be really light. And what you would do is check how your heart rate responds to it. So if your heart rate drops when you touch, but then you give it a little bit of exposure therapy, just touch, give it a bit of time to relax, touch, give it a bit of time to relax, and you see that everything kind of comes up to a normal level, then you want to just keep going at that. If you don't want to use the heart rate example, sometimes I like to use a range of motion. So test like how far does your head turn? How can you reach down and touch your toes? Then touch, reach down and touch. If it gets better, your brain's enjoying that stimulus. If it gets worse, your brain is seizing up. So your job is basically to play around and find what kind of touch, what kind of stimulation, at what kind of dose gives the brain just enough information to go, okay, cool, something's happening, but it's not too overwhelming. It's just enough information that we can deal with. And over time, it's going to start responding and adapting to that. So if you do find any of those changes happening, there is a video you can search for in the channel about scar tissue. I would also recommend, booking in a session and actually working with me. We can look through this in more detail, but hopefully that made sense as a little bit of a taster.